All right, guys, on the fly discussion. What does a thyroid ultrasound look like in patients who have Hashimoto's thyroiditis? We see this diagnosis very, very commonly, and therefore we wanted to share with you what a thyroid ultrasound looks like in someone who's had Hashimoto's thyroiditis for several years. As you can see, changes within the gland, which are very characteristics. These changes are granular changes, they're ground glass changes, they're inflammatory changes in scar tissue, and actually shrinkage over the years. Here is the images that explains everything to you in detail. All right, here's an image of a Hashimoto's thyroiditis. You can see the texture of the thyroid is a bit darker in characteristics, a little bit blotchy here, and that sits right between the carotid and the trachea, and that region and that area is definitely darker, very common characteristic of Hashimoto's thyroiditis. Here you can see further images of the gland on the left-hand side. You can see it's actually very small. Here you can see actually images of the right versus the left, and the images here. You can see the texture is very small. This patient has had Hashimoto's thyroiditis for clearly over 10 years, and therefore the gland has compensatory shrunken over time, as the patient has to be on thyroid hormone. If these patients are left untreated, the thyroid can become quite very large based on dysfunction. Here you can truly see that there is very small characteristics of the tissue here, and it's very small here. You can see the video, and you see that there's blotchy segments within the thyroid. There are some lighter, darker areas seen here on the same video on the left-hand side, very similar. You can see there's little blotchy areas, and there's loss of texture consistent with Hashimoto's thyroiditis.